Go.
Okay. So I have Elsa Sutter today. Okay. So I have Elsa Sutter. I'm going to make sure I have the right patient and it's the right time. So it's 8 a.m. in the morning, and that her allergy is to penicillin. So I'm going to be drawing up digoxin, cephalexin, NPH insulin, regular insulin, and the influenza vaccine. I looked at her chart before, and it didn't seem like she needed any of her PRN meds, so won't be giving any of those to her today. So start with digoxin, and we're going to make sure that it's the right patient, the right time, the right route, the right medication, the right dosage, and the right documentation. So starting with digoxin, it's the right, looks correct. So then yes, I'm going to do one of those, and then cephalexin, 250 milligrams, that's correct. Yes, one of those. And then I'm going to do NPH insulin, 100 units, make sure everything looks correct. One of those. And then regular insulin, looks correct. One of those. And then the influenza vaccine, 5 milliliters, make sure that's correct. Yes, one of those. And then I'm going to start taking them out. So this is the digoxin. I'm going to make sure that the expiration date is correct, the amount is correct, everything matches up with that. So I'll put that there. And then I have the cephalexin, which is 250 milligrams. The expiration date's correct, everything is in order. So I'll put that there. So then we have NPH insulin, make sure that everything there is correct, the expiration date, and then regular insulin is next. So I'm going to make sure the expiration date there, it's correct. So I'll take that out. Oh, that is pretty low. I'm going to do a different one. There you go. So that's the same. And then the flu vaccine. So there's the expiration date. It's 0.5 milliliters. Everything's correct. So I'll set that aside. So I'm done. So I'm going to log off, and I'm going to take my stuff to my second location where I'll do my second safety check. So, and get them ready to put into her. So those are ready to give her when I go into her room. Get my insulin needle, 0.5 milliliter, and then I'm gonna use a subcutaneous because Elsa's a little lady. So I use a smaller one just so that I don't hit anything I'm not supposed to hit. And then they went into her room, and her blood sugar was 352. So we're gonna have to give her 10 extra units of insulin, of regular insulin. So I'm gonna make sure I'm aware of that. sure not to touch the top because it's sterile. Yeah. So that's ready. I'm gonna take my needle out. Okay, so I'm gonna insert the NPH insulin air first, so that's 18 units. That's inserted. Now, my regular insulin's 8 units, but I'm gonna have to do 10 extra units, so that's gonna be 18 units total. So then I'm gonna insert that air in there. So this is 18 units. Sorry.
That's okay.
We're just making sure it was 18 units of insulin.
Yep.
Okay. And then I'm gonna do the same to the NPH because I need 18 units of NPH. So 36, yes. 2, 4, 6. Okay. So this is 36 units.
Yep.
Okay. Take this cap. Okay, so we got our 36 units of insulin here already. We're gonna label it. Actually, I'm gonna label first. So I'm gonna put her initials, the date, it's 2/18/20. I'm gonna put it is 36 units of insulin, 18 regular, and time, which is 9 o'clock. Let's put 9 o'clock. Okay, and then I'm gonna get it ready for her flu vac right now too. 18, 20, 9 o'clock. Flu vaccine. 5. Okay. So that's labeled and ready to go to her room. So now I'm going to top this off. only 0.5. Okay, for some reason, my thing is not. Good Lord. Make sure that's 0.5.
Yep.
Okay. Cap that. Okay, and then we're gonna we have this label here already. Okay. So I'm gonna do my second safety check here and make sure I got everything correct. So I have 36 units total, 18 of regular because of her blood sugar that we measured, and then 18 units of NPH, which adds up to 36. We have 0.5 of the influenza. Make sure the expiration dates and all the stuff that goes into that, the 6 frights and also her allergies, so we have no penicillin here. This is the cephalexin and the digoxin, and those are the correct amounts, the expiration date, everything looks right. And those are all drugs that we give her at 8 a.m. So we are ready to go to the room. I'm going to get my stuff to prepare. So I'm gonna need some cotton swabs, alcohol pads. Okay, and I would dispose of this however the facility disposed of. Like, I want to put it back. Okay. Okay, so shirt, thing, and okay. I don't think I'm forgetting anything. I'm gonna need some gloves though. So I'm gonna grab the gloves before I go into the room. Even though the room would have gloves, so then I would just. Okay. I don't know if it's knock, but I would knock on the door. Hello, Elsa. How are you doing this morning? Good? Perfect. Okay. So, if you could give me your name and date of birth, please. Elsa Sutter, 3-1 of 40. Nice. Okay. So, I'm just gonna look at your wrist, and I would look at her allergy meds, anything on here, make sure I identify that as well. And then I would note that she has allergies to penicillin, and I'm gonna double check all of this, make sure that this matches up with I have the right patient, right time. So regular insulin looks correct. Flu shot looks correct. Digoxin looks correct. Cephalexin looks correct. So then, so I'm in here right now to help you with or to give you your medications today. So, do you have any questions before we start? No? Okay, so what we're going to be giving you today is your digoxin, which will help your heart rate to slow down a little bit, and it will help your heart to keep pumping at a steady pace. So basically it's going to stop any heart problems that you may have, like your atrial fibrillation. Then I'm going to give you your cephalexin, which is an antibiotic, so that's going to help fight the infection caused by bacteria, which is will help heal your ulcer. So, and then your regular insulin, which is just a short-acting insulin, it's going to help your body absorb the sugar that you just ate for breakfast, and then it'll just lower your blood sugar, so it's going to help with your diabetes. And the NPH insulin is going to do the same thing. It's going to lower your blood sugar and treat your diabetes, and then it's an intermediate acting insulin. So, and then your flu vaccine, we have this here for you. If you have any questions or you want to look at it. So your flu vaccine is basically just going to help keep you healthy for the flu season. So why you get vaccinated. Influenza vaccine. So I'll just leave this in your room so you can look at it after I leave here. But do you have any questions about the medications you're about to get or anything? No? Okay, so we'll start with your digoxin here. So I'm gonna open this up. In there, and then I'm gonna open your cephalexin while I'm here too. Okay. So, would you like water with it or any other thing? No, you want to take it dry? Okay, I'm here to make sure you don't choke. All right. So she took that one. And now I'm going to give you your cephalexin here. Perfect. Okay, so she took both of her oral meds, and now I'm going to give her I'm going to give you your insulin now. So I saw in your chart that it was in your lower arm there, so I'm going to put it in your abdomen this time. So I would provide privacy, everything, and so it's going to go right here on her. I'm going to do her left lower abdomen here. So, but I would provide privacy and everything while I was putting it in. So now to administer it. Okay, so you're just gonna feel a little cold. I'm just gonna swab with alcohol here. Make sure we keep your things sterile. Okay, we'll just wait for that to dry. Okay. So I'm gonna uncap it. Make sure the bevel's up. Pinch, pinch, and she's a smaller lady, so I'm going to go in at 45, insert, stabilize, inject, stabilize, pull out, dispense in sharps. Okay, so if she was bleeding, I'd put a Band-Aid on her, but I did such a good job, she's not bleeding, so she doesn't want a Band-Aid. All right, we're gonna, next we're gonna do your flu vaccine here. So it's gonna go in your upper arm. I'm gonna do your left upper arm, is that okay? Okay, so I would find her acromion process here, and I go 3 fingers down. So I'd say like right there, so I'm gonna go right here on her arm. So I'm gonna switch my gloves out here. so you're just gonna feel cold again, Elsa. Perfect. Okay. So we're gonna do your flu vac now. You ready? All right, so the alcohol area is dry. I'm gonna go in at a 90-degree angle. I don't have to do Z-track or yep, or aspirating because it's a flu vac. So I'm just gonna insert a 90-degree angle, stabilize, inject, stabilize, pull out. And then I'm gonna immediately cap this, put it into sharps. So, Elsa, how are you feeling right now? Good? Okay, so we'll be back in about 20 to 30 minutes to check on you and make sure that you're okay. So thank you for being so patient. Yeah. So then I would provide privacy. She's in a wheelchair. I just make sure that she's okay. And then I would take the medication out. So, and then if she was bleeding, I would put a Band-Aid. And then I am going to take her chart as well. And then leave this where she can read it. So, and I give her her call light and all the safety things that she may need. So, yeah. Okay. So for charting, we're gonna put the time, which is 9:12, 13, somewhere around there. Okay, so 9:13, and it's 2:18:20, and then my initials here. Same thing with the cephalexin. And then the NPH insulin. Time, date. And then I'm going to add lower left abdomen. And then my initials. But the same thing for the regular insulin and the sliding scale. My initials. Okay, so then influenza vaccine. There we go. So that's my final documentation. And then my S bar is going to be at 8 well, it's supposed to be 8 a.m. this morning, but it's 9 right now. Elsa Sutter, date of birth 3/1/1940. She was admitted yesterday with an infected diabetic ulcer on her right heel. Mrs. Sutter has a history of diabetes and asthma. After admission, the sliding scale was added in her orders. So today her blood sugar was checked and it was 352. So I gave her 18 extra units of insulin, not 18, 10 extra units of insulin. She will, I gave her insulin, situation, what I did. So I gave her her flu vac, her normal morning meds, so her digoxin and cephalexin, and her insulin, and her vitals were blood pressure, 134/86, and because she didn't need her blood pressure checked or respirations or anything checked when I was in her room, I did not do that because her blood sugar was already checked, so I already accounted for that. So I didn't administer any of the PRNs because she didn't seem to need it, but when you go back in 20, 30, 60 minutes later, ask her how her pain is and if she needs any of her PRN meds and if she's comfortable, because her arm will probably be a little sore from the flu vaccine. So, yep.